welcome back to Healthcare Experience Matters. Today we have joining us Michelle Spurlock, Vice President of Nursing Services at Acadia Healthcare. Michelle, please just introduce yourself and tell our listeners about your professional background and what your current role with Acadia Healthcare entails.
Sure. First of all, let me tell you a little bit about Acadia Healthcare. So our office is in Franklin, Tennessee, and we are the largest healthcare company that focuses only on behavioral health. So we have about 239 facilities across the country. That's 39 states, including San Juan. We have acute care hospitals, residential treatment center facilities for treatment of adolescents. We have our recovery programs, and then we have our comprehensive treatment centers that focus on opioid addiction. So I'm proud to say that my entire 37 years of nursing is in behavioral health. I think from the moment I was in nursing school, my teachers even knew I was going to be in behavioral health, because I remember being pulled aside at one point. They said, "Oh, you're one of those." And I didn't know what that was at 19 years old. And they said, "Well, you're a psych nurse." And so went into psychiatric nursing, obviously spent a number of years working the floor, and then very soon evolved into various leadership roles, charge nurse, house supervisors, and then, director of nursing, and have worked in a variety of healthcare settings. My home is Louisville, Kentucky. So probably the first, 19 years of my career were in settings in Louisville. And then over the last part of my career, I've worked with various healthcare companies in various leadership roles. And, currently, I can't possibly visit all those facilities, but I support the nursing leaders and the facility leaders of all the facilities to look at ways to improve patient care, patient safety, provide mentorship to new nursing leaders. And we are in the process of opening hospitals. So it's great to be able to be a part of, a company where we're opening hospitals to increase access to care for behavioral health.
That is excellent. And before we talk more about elevating the patient experience in behavioral health, why don't you tell our listeners something unique about you that we wouldn't find on your CV or resume?
Well, for those that do know me, they know that besides being passionate about psychiatric mental health nursing, I love music. And actually, when I was in nursing school, I took voice lessons into classic Italian opera, of all things. But for the last 8 years, I have been in a band with my husband. And so we've been married for about 35 years. And so we're in a blues band together. So about once a month, I get to have my music therapy. So it's been a fun way to kind of deal with my own mental health.
That is very cool. And so, behavioral health, you've said earlier that people kind of called it out early that was going to be your calling. So what brings you the most joy when it comes to your work in behavioral health? Why did you choose it, or why did it choose you?
As long as I can remember, even in school, people would talk to me, whether it be a school bus, people tell me about their challenges or difficulties with boyfriends. And then, like I said, in nursing school, my patients would tell me things that they hadn't told their doctor. I think of one in particular, a 13-year-old who tells me as her nursing student that she's tried to commit suicide because she was having some sexual identity issues, had never told anyone. So here's a nursing student asking a psych consult. And it was after that one that my instructor pulled me aside and said, that I was one of those. So, I went into behavioral health. All areas of healthcare are important, but I look at the holistic part of behavioral health. When people are coming to you, they're coming to you at their most vulnerable point. When you think of someone who has lost their desire to live, they see no reason for them to continue to live. And when you're able to work with them and the families and see somebody come through that and have, a reason to live again, it's pretty rewarding. When you're looking with the families who then tell you later on, thank you, because, you were part of giving them their loved one back. When you look at the impact of mental illness on not just the individual, but their family, the neighbors, their community, for me, that's just really a huge mission. And earlier in my career in the 90s, hospitals were closing their psychiatric units. There was managed care had come into place and facilities were closing their units. Even mine in Louisville, went from having 3 inpatient units gradually, reducing the sizes. So now in my current role, while I'm not doing as much direct patient care, to be a part of, building a new hospital and bringing access to care, and sometimes in remote areas that haven't had that access, and to know that I'm having, indirectly the impact on so many people, it's just really rewarding.
As far as you see it, Michelle, tell us about what are some of the most pressing issues right now that are impacting patient care.
Well, the last 3 years has been quite challenging for all of us, right? I mean, when you think about COVID, and when you think about those who have mental illness, they already struggle with access to care or being isolated to begin with. But COVID really forced that more. And so I think that, we're seeing, and you see it in the news, the increase in suicide rates. I think that one article I read that from the U.S. Center for Disease Control was like there's 1 death every 11 minutes. And so in the United States, and then when you couple on top of that, was it over 100,000 overdoses. So, that's huge for our country. And again, there's just such a need for services. Then when you look at the child and adolescent needs, again, with COVID, for many children and adolescents, especially that are part of dysfunctional families or families that have various challenges, school was their safe place, right? So you knew that, for some that were maybe struggling financially, that's where they got their meals. At least had some sustenance. But for those that maybe had family members that struggled with mental illness, they didn't have a safe place anymore. So I think that's something that we're seeing. I know we see that in terms of increased need for services, and we need more behavioral health nurses. You may not realize that only 3 to 4% of nurses go into psychiatric mental health nursing to begin with. And I know, my situation was unique, but my teachers told me to. That was, a long time ago. But I think that there's this thought that, I have to have medical surgical experience first. But if you're someone that's really geared towards that aspect of taking care of someone's mental health, and, you're just, the medical side isn't for you, I would just encourage nurses, if that's your passion, to really go into mental health nursing, because people are afraid of losing their skills. But, patients more than ever have medical comorbidities. And so I need people, you're not going to lose your skills. You still have those assessment skills. But again, I think you have that holistic approach. But when you look at the retirement, a lot of nurses are my age, I'm not so close to retirement, but, we need more nurses in behavioral health to handle the needs that are, becoming more and more apparent.
So we love talking about engaging the workforce here on this podcast. What are some of the more important focus areas that might impact having an engaged workforce in behavioral health?
Well, again, since 3 or 4% go into behavioral health, we need to keep everybody that does go into it. So engagement's never been more important. I was really lucky early in my career. I trained with Quint Studer. I don't know if some of your listeners, the Quint Studer and looking at hardwiring excellence. But, we talked about engagement then, and the same principles hold true today. I think people want to be heard. They want to be valued. They want to know that they make a difference. And one of the things that, I still do today that was taught when I worked with the Studer group was looking at rounding with a purpose. So, if I were rounding, on you, I'd be like, hey, Casey, can we talk for a few minutes? And you go, okay, we talk. And I'm like, what's working well right now? How are things going for you? Is there anything that's not going well that I should know about? Do you have the tools to do your job? Is there anybody that's done anything extraordinary that you'd like for me to recognize, or, to talk to? And is there anything else I need to know? It's a really quick conversation, but it doesn't have to be in an office or anything scary, but then I follow up with you. And I'm like, hey, Casey, I want to let you know, thank you so much last month for telling me about X, Y, and Z that, you didn't have. We've ordered it. We have it now. So I think that, when you have that level of engagement and communication and visibility, it makes a huge difference. And with rounding with a purpose, for example, if I'm coming to you on a regular basis asking for your input, you're much more likely to come to me yourself when there's an issue, because you know that I'm going to follow up with it and it matters. And so, those are fairly simple things that I don't think we do a really good job with. And we also don't reward and recognize people. We're so fast paced in healthcare, and there's so much going on. And, we may have surveyors coming in for regulations. We're focusing on doing things right. But we need to focus on rewarding people when they are doing things right and celebrating your wins along the way. And I think that's another way to keep your team engaged, because, people still say that folks leave their manager, right? It's kind of like the person they work with directly. So that's just how I try to coach the nursing leaders that I work with.
Some amazing points are being made on this interview, and I want to move on now. So tell us about some of the important focus areas that impact the patient experience in behavioral health.
What is the saying? You only have one chance to make a first impression, And, as I stated earlier, when people come to you in behavioral health, they're at their most vulnerable. And so it's important that you are aware that every single interaction that any employee in your hospital has could be the one that makes a huge difference. I mean, when someone's walking in the front door of your hospital, people typically don't wake up in the morning and say, hey, I think I'm going to go to a psychiatric hospital. I mean, something's been going on with them that sometimes it's not voluntary, but when they come into the hospital, the people that they meet, are they welcoming? Are they kind? Are they speaking directly to you? I don't care how many admissions maybe you've had at the hospital for that day, but at that moment in time, that patient, that family needs to be the absolute focus of your attention. Because again, maybe the person is suicidal, they've had an overdose, or maybe their mental illness is out of control, they've been off of their medication. So I think that that's really important. Even though it's gotten better, I think there's still a stigma in behavioral health. There are still, the hesitation for people to seek treatment. I know that when I look at working with older adults, part of my career worked with that population exclusively, but I remember that, men over the age of 65 are more common for completing suicide. And when you look at a high percentage of them saw a medical doctor within 30 days of their suicide. It's really staggering to me. So I think that we have to be a safe place and be very aware of our interactions with the patients. I think also then what plays a big role in it is the environment. Years ago, the psychiatric hospital of the past could have looked pretty sterile. And so in terms of the hospitals I know that we're building, really focus on daylight, making sure that the environment is homey, it feels comfortable. You want people to feel safe. And so a lot of what we're doing in the environment for that patient experience, is providing for that safety too. And so if you do any type of patient satisfaction surveys, which again, most of us do, you're looking at commonly the patients responding to, did I feel safe? Was I involved in my care? Was it explained to me the whys? And again, in behavioral health, I know when you go into a medical hospital, some of your belongings are taken away, but in behavioral health, that's really, so much is taken away for safety that I think it's important that we explain that along the way so it's not so scary. It's like, hey, I'm going through your belongings because I want to make sure there's not anything that you could, use to hurt yourself. We want you to be safe here. So it's, again, explaining the why, treating the patient with dignity and respect, and then having a inclusive, robust therapy program. In behavioral health. But when someone comes to the hospital, it's more than, seeing the doctor and being in a safe place and taking medication, but making sure that you have programmatic 7 days a week, that it's throughout the day that, we're focused on helping the patient learn skills to help them re-engage, at home when they're discharged.
Michelle, this has been a great conversation, and I'm going to give you the final word. So if there's anything else that we had missed that you wanted to mention for our listeners, feel free to let us know now.
My career, one of the things I've found is that people who are drawn to work in the behavioral health field have had their own personal experiences, whether it's their own personal, dealings with, mental illness or substance use disorders or family. And so when you work in the field, we have to realize that sometimes working with patients or, family members that are a little bit too close to our own experience can be really triggering and can cause people to have their own, kind of like flashbacks or issues. So I think it's really important that we take care of our own mental health and that we take care of each other. When we go into healthcare, we want to take care of others, and we can be so focused on that we forget to take care of ourselves. And, I think that's become even more apparent as you look at COVID and how hard people have worked, and the nurses and everything, and they're dealing with their own PTSD from those experiences. So I'm glad to see that there's more discussions in the media about taking care of yourself and mental health, in hopes that again, further destigmatizes it so that we are taking care of ourselves. And I just think that's something that we need to remember to do, and to be looking at the folks that we work with and know when we need to say, hey, I think, let me help. Let me support you.
Michelle Spurlock has been our guest today on the Healthcare Experience Matters podcast, talking about behavioral health. And Michelle is the Vice President of Nursing Services with Acadia Healthcare. Michelle, thank you so much for your time today.
Thank you. It's been my pleasure.